This video is about American Heart Month focuses on topics related to cardiovascular health, including maintaining a healthy weight, diet, stress management, exercise, blood pressure control, heart failure, stroke awareness, heart valve disease, quitting smoking, and the importance of regular checkups to identify potential heart risks. Heart failure. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. This impacts blood flow to vital organs like the kidneys, lungs, and brain, affecting the entire body. The heart's primary role is to ensure oxygen-rich blood reaches all organs, but when it fails, this process is disrupted. Common symptoms of heart failure include fatigue, swelling in the feet or legs, weight gain, and shortness of breath. Left-sided heart failure often results from conditions like coronary artery disease, heart attacks, valve problems, hypertension, or diabetes, which either weaken the heart muscle or make it too stiff to feel properly. Right-sided heart failure, which reduces blood flow to the lungs, is most commonly caused by left-sided heart failure, but can also result from congenital heart defects or lung conditions like COPD. With multiple types of heart failure, understanding the specific cause is key to managing the condition. Consulting a healthcare provider is essential for a clearer understanding and proper treatment. Atrial fibrillation. Atrial fibrillation overview. Atrial fibrillation, AFib, is an irregular and often rapid heart rate that can increase the risk of stroke, heart failure, and other heart-related complications. It occurs when the heart's two upper chambers, atria, beat irregularly and out of sync with the two lower chambers, ventricles. This irregular rhythm can cause symptoms such as heart palpitations, shortness of breath, and weakness. AFib episodes can be occasional, persistent, or permanent. While some episodes resolve on their own, others may require medical intervention. Though atrial fibrillation itself is not typically life-threatening, it is a serious medical condition that sometimes necessitates emergency treatment. One of the major risks of AFib is the formation of blood clots in the heart. These clots can travel to other parts of the body, causing blocked blood flow, ischemia, and increasing the risk of stroke. Treatments often involve medications or procedures to restore a normal heart rhythm or manage symptoms. Symptoms? Some individuals with AFib experience no symptoms and may only discover the condition during a routine physical exam. For others, symptoms may include heart palpitations, a racing or irregular heartbeat, weakness, fatigue, dizziness, confusion, shortness of breath, and chest pain. Reduced ability to exercise and lightheadedness are also common signs. Types of atrial fibrillation. Occasional, paroxysmal. Symptoms come and go, lasting from minutes to hours, and often resolve without treatment. Persistent. The irregular rhythm does not correct itself and requires medical treatment such as electrical shocks or medications to restore normal rhythm. Long-standing persistent. This form lasts longer than 12 months and typically requires ongoing management. Permanent. The abnormal rhythm is continuous and cannot be restored. Medications are often needed to control heart rate. When to see a doctor? If you experience symptoms like palpitations, chest pain, shortness of breath, or persistent fatigue, consult a doctor promptly. AFib is diagnosed using tools like an electrocardiogram, ECG, which can confirm the irregular heart rhythm and differentiate it from other arrhythmias. Early diagnosis and treatment can help prevent complications and improve quality of life. Unhealthy weight, particularly obesity, places excessive strain on the heart. Excess fat tissue requires more oxygen and nutrients, which increases the heart's workload to pump blood throughout the body. Over time, this elevated demand can lead to high blood pressure, one of the leading causes of heart disease. Obesity is also associated with high cholesterol and triglycerides, which can lead to plaque buildup in arteries, restricting blood flow to the heart. This condition, known as atherosclerosis, increases the risk of heart attacks and strokes. Excess weight can also lead to insulin resistance, a precursor to type 2 diabetes, which further elevates cardiovascular risks. Fat accumulation around the abdomen, or visceral fat, is particularly dangerous, as it produces inflammatory substances that can damage blood vessels and the heart. Being overweight often results in lower levels of physical activity, which weakens the heart muscle and reduces cardiovascular fitness. Sleep apnea, a condition linked to obesity, causes disrupted breathing during sleep, straining the heart and leading to irregular heart rhythms. Managing weight through a balanced diet, regular exercise, and healthy lifestyle choices is crucial to maintaining heart health and reducing the risk of cardiovascular disease. Heart valve disease. Heart valves play a crucial role in controlling blood flow and ensuring it moves efficiently through the heart and to the rest of the body. When heart valves become diseased, they may develop leaks, causing blood to flow backward, regurgitation, or they may narrow and become stiff, stenosis, restricting how much blood can pass through. These issues can compromise the heart's ability to pump blood effectively, leading to a variety of health problems. Without proper blood flow, the heart must work harder, which can result in fatigue and reduce overall heart function. Symptoms of valve disease are often similar to those of other heart conditions and can be difficult to distinguish. Common signs include fatigue, shortness of breath, and difficulty performing physical activities such as climbing stairs. Increased tiredness after exertion may also indicate a valve problem. Because symptoms can worsen over time, it's important to consult a cardiologist if you notice persistent fatigue or breathing difficulties. Early detection and evaluation can help prevent further complications and improve outcomes. The most common cause of valve disease is calcification, a condition in which the valve becomes stiff and rigid due to a buildup of calcium deposits. This often occurs with aging, as the valves naturally become less flexible over time. The aortic valve is particularly prone to calcification, which can significantly reduce its ability to allow proper blood flow to the rest of the body. Other risk factors for valve disease include smoking, high blood pressure, and heart infections, which can damage or weaken the valves. Infections, such as endocarditis, can cause serious damage to the valves by introducing harmful bacteria that lead to inflammation and scarring. Preventing these infections and managing lifestyle factors like smoking and hypertension are essential for maintaining valve health. Addressing the symptoms and underlying causes of valve disease early is key to avoiding serious complications. If you suspect heart valve problems, consult a healthcare provider for evaluation and to explore treatment options. By taking proactive steps, you can protect your heart and overall health. And now, heart infection. Similar to other organs in the body, the heart is at risk for developing infections caused by bacteria, viruses, and other organisms. Heart infections can impact the ability of the heart to function properly. Since the heart pumps blood to the rest of the body, an infection in the heart can put other organs at risk of becoming infected. However, prompt identification and treatment can help ensure these infections are under control. Infections in the heart are described based on where they occur. Endocarditis, the inside lining of the heart, is infected. Myocarditis, the heart muscle, is infected. Pericarditis, the outermost lining of the heart, is infected. In addition, the different valves of the heart can harbor infections which can lead to valvular heart disease. Symptoms? The symptoms of a heart infection are similar to other infections. You may experience fever, cough, chills, general fatigue. Heart infections may also cause discomfort in the chest, difficulty lying down, or difficulty breathing. Some infections can cause discoloration of your nails or skin. Causes and risk factors. People who undergo heart surgery or interventions to treat the heart are at the highest risk of infection. If you have an artificial heart valve, you are also at increased risk of developing a heart infection. In addition, drug use with injected drugs is linked to higher risks of heart infections. When should you call for immediate medical help? Heart disease is a serious and sometimes life-threatening issue. Seek medical attention if you experience pain, pressure, tightness, or discomfort in the chest, shoulders, arms, neck, back, upper abdomen, or jaw. Difficulty breathing and fatigue. Sensation like your heart is racing in your chest. Passing out? If you think you may be having a medical emergency, contact 911. If you think you may be having a medical emergency, contact 911. Congenital heart disease. Congenital heart diseases are those that are present at birth. Many congenital heart diseases occur due to changes in heart structure that occur during development. Congenital heart diseases are usually diagnosed shortly after or within a few weeks of birth. Recent advances in prenatal care allow healthcare providers to identify some congenital heart diseases during pregnancy before the baby is even born. Most hospitals will screen babies for heart disease. 5. Symptoms? Babies born with congenital heart disease may have difficulty feeding and may tire easily. Babies can also have trouble getting enough oxygen, so their skin may have a blue discoloration, especially around the lips and on the toes. Sometimes swelling in the hands and feet can develop if the heart defect is severe. Causes and risk factors. The exact causes of most congenital heart diseases are not fully understood. We do know that many congenital heart diseases are the result of genetic mutations. In addition, certain risk factors like alcohol or drug use during pregnancy can increase the risk of congenital heart disease. Some medications can also increase the likelihood of heart defects developing during pregnancy. And now, cardiomyopathy overview. Cardiomyopathy is a disease of the heart muscle that affects its ability to pump blood effectively and can lead to heart failure. The exact cause is often unknown, but genetic factors frequently play a role. There are different forms of cardiomyopathy, which may involve structural changes in the heart or impair how the heart functions. Tests like echocardiograms are used to diagnose and assess the condition. Symptoms of cardiomyopathy include fatigue, dizziness, and difficulty with activities like climbing stairs or lying flat. Swelling in the feet and legs, especially after prolonged sitting, is also common. Arrhythmias, or irregular heartbeats, are another potential complication of the disease. While some cases are linked to genetics, other factors, like extreme physical or emotional stress, can trigger cardiomyopathy. This includes broken heart syndrome, which can occur after significant emotional trauma, such as the loss of a loved one. Ongoing research aims to better understand why some people develop cardiomyopathy and how to improve treatment options. Frequently asked questions. What types of drugs are used for treating heart disease? Numerous medications are used to support the heart and help it pump with heart disease. Types of medications include beta blockers. These help to slow the heart down so it may pump effectively. Hypertension drugs. These help reduce the pressure inside blood vessels so the heart can work more efficiently. Statins. These help lower cholesterol levels in the body and prevent dangerous plaques from forming. Diuretics, sometimes called water pills. These help reduce the fluid levels in your body and allow the heart to pump more effectively. Many times your healthcare provider will want you to take these medications in combination. While this may seem like a lot of pills, they have the best effect when used together. How many types of heart disease are there? There are over 30 different distinct types of heart disease. Many of these diseases have their own subtypes, which can make these disorders even more complex. Since there are so many different heart diseases, there are specialists who only treat heart disorders such as cardiologists. What are the signs of an unhealthy heart? When the heart is unhealthy, you may experience chest pain, fatigue, swelling in your feet, difficulty breathing. In some cases, other organs like the kidneys can become damaged if your heart is unhealthy. Healthcare professionals can evaluate your heart and other organs if you feel that you may have an unhealthy heart.